Welcome back to the Senior Focus. I'm Nick Caltis. I'm here with Kristen Cooney from Tufts Health Plan, Medicare Preferred.
Very good. It's a long title, huh?
That is a long title.
I understand.
I'm kind of proud of myself that I said it.
So am I.
Yeah.
Yeah.
Well, thank you. I appreciate that. So we talked about what Medicare is.
Mm-hmm.
It's an entitlement, right? If a person is insurable,
Mm-hmm.
and that would be the 40 quarters,
Correct.
they have an entitlement to this insurance.
Correct.
And it is, in essence, health insurance.
And that's the way it was designed.
Right.
So your Part A is your hospital coverage and your Part B is called medical, so it's everything that you would do outside of the hospital.
And we spoke about enrollment, which really is a complicated issue. The open enrollment for those that have
Their Medicare, yep.
insurance,
Yes.
October 15th through December 7th.
Correct.
And they can make changes to their plans as need be.
That is correct.
And for someone who doesn't have the insurance, because they're not 65 yet,
Right.
or they turn 65 before the open enrollment period, during that year, can you review with me again what the enrollment window is? It's 3 months before their
Yes,
birthday.
so they call it the initial coverage election period. You're
Okay.
turning 65. So let's say it was July 1st.
Yep.
So 3 months prior, the month of, and 3 months after, you can enroll into Medicare.
Right.
You can take your Part A and your Part B at that time, or you can just enroll in Part A, which Medicare would like you to do, even if you don't plan on getting the Part B because you have coverage through employment or through a spouse's employment.
And that coverage needs to be the same as or better,
Or better than what the Medicare, correct, correct. So that 7-month window allows them to enroll. If they need both pieces, the A and the B, they can do that in that 7-month window, or just get the Part A. If you're just getting the Part A, they'll send you the card. Just tuck it away. You don't need it for your insurance. You're not using it to go to the hospital. You're using your insurance that you have, whether, like I said, through an employer or spouse's coverage. Once you get the A and the B, that tells us that you do need your insurance because you don't have any other credible coverage. So let's say you enrolled in something and you waited until the annual election period because you just had Medicare, and you didn't get anything else. The annual election period or open enrollment would allow you to enroll in other types of plans in that window, and you would become effective the first of the year.
Okay. Now, are there out-of-pocket costs that would be associated with Medicare? If
There
someone
are.
has Medicare coverage, they get sick, they go to the hospital, are there out-of-pocket costs that they have to incur as well?
Yes. With Medicare A and B, Part A has a deductible.
Okay.
It is $1,216 this year.
Now,
So it changes every year. The deductible gets higher every year.
is there the availability of Medicare A, coverage with no deductible? Like, can you look at Medicare A and there are different, different scenarios? No?
No.
Yeah, so
If you're just using Medicare as your insurance, it comes with your co-insurances and it comes with deductibles. So think of it just as any other insurance you may have, different companies.
Yep.
It'll say, okay, this is your deductible, this is your co-insurance, these are your co-pays. With Medicare, using Medicare as your insurance, you have a deductible on Part A, so the first night you're admitted in the hospital, it's $1,216, and that is per benefit period, and a benefit period is 60 days. So if, for example, you were hospitalized February 2nd, and then you went in again March 15th, you're within
Same
that
benefit.
60 days, correct.
Okay.
But if you go in again in September, it
Different.
resets another $1,216.
Okay.
With your Part B, there are deductibles and co-insurance. So Part B has a $147 deductible, but that is per calendar year, and then 20% co-insurance for those bills. For example, you're seeing a physician, they order a test, they order lab work, you'd pay the first part of the deductible, the $147. Once you've paid that, you've met that for the year, but then you're responsible for 20% coinsurance of all the Medicare-approved
So
services.
is that deductible, the 147
Yes.
that you mentioned, is that for the for the period, for the deductible period, or for the year?
For the year.
Okay.
So the Medicare resets every 60 days.
That's very
Part A.
affordable. 147.
The 147 is
Yeah.
just once a year. So if
Yeah.
you went to the doctor in January
Right.
and you spent that 147,
That's it.
you have no more deductibles for the rest of the year, but you do
That's
have the
B,
20%.
right?
Correct.
Okay.
Correct.
So you go to the doctor, you see the doctor, you've satisfied your 147, you've paid the 147, you see the doctor. What kind of paperwork comes back? They
Well, the bills will go to Medicare.
okay.
And
so
then Medicare will look around and say, okay, we're going to send the balance to the coinsurance, and that person would be responsible
right.
for
So
those.
the doctor's going to send their request to
Medicare.
Medicare.
Correct.
Medicare will provide whatever benefit is due the doctor.
Correct.
And then they send the insured
Correct.
a statement that says, okay,
You have-
this is what the charge was, this is how much we paid, this is what your obligation is. Is that right?
Correct. Correct.
Now, whether it's A or B, there are deductibles that are associated with those plans.
Correct.
And again, what is Medicare C?
Part C,
Yeah.
it's a whole alphabet.
Yeah.
We have Part C and Part D. Okay? Part C are Medicare Advantage plans.
What is an Advantage plan?
It is a plan
Yeah.
that is your primary insurance,
Okay.
and Medicare will pay a private insurer to take care of you.
Okay.
So you have your Medicare Part A and B in place, and you need to have them in place.
Okay.
And when I describe it to people, I say, think of it as a ticket, and you get your ticket punched, and then you're all done with your ticket. You have your Medicare in place. You're always paying that Part B premium.
Yeah,
It
yeah.
doesn't go away.
Yeah.
But you're using it to enroll in a primary insurance, which is a Medicare Advantage plan.
Okay.
Under the umbrella of a Medicare Advantage plan, you can pick up a drug plan with it
Yeah.
or
So
not. So your
would
Part
that
D.
be Part D?
Correct.
Okay.
So under that umbrella, you can choose a drug plan, so you've met the Part C and the Part D.
Now, just briefly, because we're running out of time.
Okay.
When I think of Part C, and I might be in error here, I'm thinking that it's a program that can help a person with the deductibles that they face in A and B. Is that right or wrong?
Well, there are plans that do that, but they are not called Medicare Advantage plans. They're called Supplement or Medigap plans.
There are a lot of different plans.
And people use the word supplement interchangeably for everything that's available to them as a Medicare beneficiary.
Okay.
But there is specifically two design plans. One is the Medigap, which is what you're talking about.
Yep.
Your Medicare is the primary, and then you look around for something to fill in that 20% in those deductibles.
Medigap.
Medigap or a supplement, correct.
So
And it's
whatever
different
gap
than a
in
Medicare.
coverage there is, they plug
Then you,
the gap.
correct. That is correct. So you can choose options that cover the deductibles and the coinsurance, or just the coinsurance, and you're responsible for the deductibles.
You know, Kristen, this is complicated stuff. We could talk about this forever.
Probably could.
Yeah, I think that we could, but I'm afraid we have to go right now.
It's all right. This was fun. Thank you.
You know, I want to thank you for coming, really. And Medicare open enrollment is, you know, right around the corner.
It is.
Something that people really need to take advantage of. So in any event, we've got to get you back on the program so that we can
Love
talk
to.
more in detail about these things.
Great.
But we're going to head off now, and I want to say that the conversation continues Saturday mornings at 9 a.m. on WCRN Radio. Join us next week for more Senior Focus.